I suppose I'm involved in the healthcare industry for over 30 years. I started off in the Richmond Hospital, which is no longer open, I'm afraid. It's now just a courthouse, I understand. And I started off and I trained as a cardiac technician. And I stayed with that for a little while. And eventually I decided it wasn't for me. One of the things that helped me come to that decision was the National Dairy Council decided to have a fun run on a Sunday at 2 o'clock in Dublin. And they invited people to go for a run with their families. And I was sitting at home with my family having Sunday lunch, and my bleep went off. And when I got to our coronary care unit in the Richmond, which consisted of 5 beds, 3 female and 2 male, we had 22 patients lying around the place. And unfortunately, we lost some of them. And the reason, we lost them was people weren't prepared. These people were invited to go for a fun run, and it just didn't work out. So I think things have improved quite a bit since then. As John said, I joined VHI over 30 years ago. And for the last 15 years in VHI healthcare, I was responsible for dealing with a number of the private hospitals. And I'm a bit of a poacher come gamekeeper, because 8-9 years ago, I was part of the team that went to the private hospitals and said, you must get accredited. VHI are not going to continue to approve you guys. So a lot of people in the Blackrocks, the Vincents, the Matters, the Bonds, didn't take very well to people from VHI telling them to do that. But I'm personally of the view that those private hospitals provide a much safer service now that they have JCI accreditation. As John said, last July, 12 months, I was appointed to VHI Home Care. And to be honest with you, I didn't know a lot about it. I knew it existed. And the history of it is that VHI decided there was a company called Tara Healthcare. And Tara Healthcare were providing this service to the HSE. And somewhere along the way, the HSE and Tara Healthcare parted company. And Tara Healthcare then came to VHI and said, we were providing this service to HSE patients. We were taking public patients out of the public hospitals a little bit sooner, and we think we could do the same for VHI Healthcare. And VHI Healthcare then partnered with Tara Healthcare, a JV, and that stayed in place from 2010 until 2012. And in 2012, VHI bought out the directors in Tara Healthcare. And the service became totally owned by VHI Healthcare. So what is home care? The name is a bit daft. We get phone calls from people regularly saying to us, could you send somebody out for 2 hours to sit with my mother and my father? That's not what we do. And it's something that we're seriously considering changing. We're the only consultant-led service that provide home care in the state. We have a medical director who is a full-time consultant in Beaumont. And we have a team of doctors who work full-time with us, and we have locums at weekends. Our members, patients can access it if they have VHI membership, if they have ESB and Garda Medical Aid. It is not at this point open to other insurers or self-payers. The patients we treat, really, it's anybody who requires an IV infusion. And some of those patients require an IV infusion once a day. Some of those patients require it 3 times a day. And so far, we have treated almost 3,000 patients since we started. And that has saved VHI in the order of about 14 million. So, the view is that patients much prefer to be treated at home. And when I arrived in VHI home care, and I remember saying to Catherine and Fiona, how are we viewed by the membership, by the people who use our service? And the girls said, oh, 99% of our patients love us. And I said, 99%? No. So I went out and I looked at the program myself. And I went out and I visited patients with their permission. And I was absolutely blown away by it. The number of patients who said to me, there's no MRSA in my kitchen. You know, and so it has gone from strength to strength. So, who do we treat? As I said, patients on IV antibiotics for various reasons, patients on negative pressure therapy, patients requiring anticoag, and patients on TPN. And the TPN patients obviously are a challenge, but what we are learning is that we're getting a higher level of acuity of patient than we were in the first year or so. We also deal with post-operative patients, those patients who have stoma and who require drain care. Our decision to become accredited, well, it was a VHI healthcare requirement. I actually have a contract signed with VHI Home Care and VHI Healthcare, which says I must have accreditation, or else VHI Healthcare will not recognise VHI Home Care. But we wanted a framework for quality. And we wanted to put in place, you know, a desire within the organisation to actually, you know, ensure that quality was at its foremost. And we wanted the best patient outcomes. And obviously, we wanted to increase the confidence of our stakeholders. And our stakeholders are the consultants who refer to us, VHI Healthcare, and very much even the people who work for us. The challenges are enormous. Managing a change in such a short period of time was incredible. Like the increase in the documentation of paperwork that was required drove some of us mad, John. The additional resources, we didn't get it right the first time around in relation to resources, and I tell you why. We thought we could do it with the same people and run the business in the normal way, and that didn't work. So when we had our pre-survey, and when we picked ourselves up off the ground after the survey, we then decided to allocate dedicated resources to it. And having done that, it worked very well. The financial outlay was considerable. But I have to say at this point, it was worth every penny. And we did meet resistance to the change. We have about 60 nurses, and some of them didn't like the idea of this accreditation piece. But in fairness, they came around to our way of thinking, and I believe if you ask them now, they would be happy to say it was the right thing to do. The benefits, well, we have improved the confidence among ourselves in how we do things because we're now providing a quality-driven service. And obviously we have a recognised framework in place, and we have actually put in place improvements in all our work practices across our system. So, but one of the things that has jumped out at me is the way in which we have changed the way we do business with other people. And that, to me, is one of the greatest things, even in the sense of dealing with new suppliers. So it has worked very, very well for us, and we're very, very pleased with the way things have gone. We have got accreditation. We have got to the mountain. We have to stay on top. And that's the work of the next two years. Our learning. You just have to have buy-in at every level, from the board to the lowest point on the ground. You have to have buy-in. You have to allocate the appropriate resources. You cannot do it piecemeal. We learned that. After the first 6 months, we realized this was not working, so we had to allocate the appropriate resources, and I'm glad we did. From my point of view, I would suggest to everybody, you have to allocate more time than you actually think you need to get this process. You have to do that. And you have to, at the same time, continue to run your business. Because VHI Home Care is a business. I have a board that I report to. So you have to allocate all the time you can and keep the business going. The survey week, will we ever forget it? I have to say we were prepared incredibly well by HCI. It was a great advantage to have them on site during the course of the 4 days. The stress levels, unbelievable. And that was just me. It was unbelievable. But not every day of the survey was a good day. Day 1, great. Day 2, not bad. Day 3, nightmare. We almost crashed and burned on day 3. Day 4, we got it back. And how we got it back was very simple. We have our weekly clinical meeting that takes place. We review all our patients with our doctors, and we invited the surveyors to attend. And when the surveyors attended and they saw the level of acuity of patients that we dealt with, they were kind of blown away. Earlier on in the week, one of the surveyors had said to me, I actually think you're overstaffed. I actually think that, you have too many clinical people at such a high level. And on day 4, after he saw the weekly clinical meeting and the review of all the patients, he called me aside and he said, I need to talk to you. And I went, oh God, we're in trouble. And he said, the comment I made to you on Monday, he said, about having too high a clinical staff, obliterate that, he says, from your memory. He said, you have the right balance. The management of the surveyors, very difficult, because you can't bring these guys out for lunch. You can't bring them out for dinner or go for a pint with them. They kind of live on their own little space, Even when you give them newspapers in the morning, they give them back to you in the evening, So it was like having a guest in the house, but you only spoke when you were spoken to. So that's about it. That was our experience of the accreditation piece. It went very, very well. Again, HCI were absolutely fabulous. Could we have done it without them? Probably not. Probably not. I would describe it as trying to do a day's work and do your master's by way of correspondence, not having HCI on board. So that's me.